Thank you for calling abortionclinics.org. To make an appointment or to reach a receptionist, please press 0. Abortionclinics.org, how can I help you?
Yeah, I was wondering if you guys do abortions at 26 weeks of pregnancy.
We do in Maryland.
Okay. How much does something like that cost?
It just depends on your medical history.
Okay.
Let's see here. Is it for you, hon?
Yes.
Okay. Do you have a history of having any C-sections?
No.
Do you have any major medical problems at all?
No.
Is there anything wrong with you or your pregnancy?
No.
What's your height and weight?
5'3", and I'm 165.
Okay. And do you know your blood type?
A positive.
Okay. So based on that information, at 26 weeks, it's $7,000.
Okay. Well, I was just mostly wanting to get some information. I've sort of been going back and forth on my decision, so I wanted to see how much it was and if you guys could actually do it. And, are you able to tell me, what the procedure is?
Yeah. So basically, we can see you up until 28 weeks. If there's no medical reason after 28 weeks, it's a case-by-case basis. And right now, at 26 weeks, it's a 3-day procedure. The first 2 days, the first day you'd be in the clinic, the doctor would do an injection through your abdomen wall into the uterus and into the fetus's heart, which would actually stop the heartbeat the first day. And we also, on the first day, second day, basically are dilating your cervix. We insert what's called Laminaria. It's an FDA-approved seaweed stick. Kind of looks just like a little small wooden stick. Sits in your cervix overnight and absorbs body fluid and expands kind of like a tampon will to be able to open your cervix up.
Mm-hmm.
And on the last day, which would be the third day, basically you would essentially be induced for a labor.
Oh.
And then if you wait until 27 weeks, it becomes 4 days. So first 3 days are dilation, and the last day is the induction.
Okay. And so when you say labor, you mean just delivering the baby, or?
Yes, essentially it's a stillbirth.
Okay. And then do I get pain medication throughout it all, or is it high pain?
So we do a cervical block, so we numb your cervix. You also have the option for IV sedation on top of that if you'd like, at no additional charge. So it's a conscious sedation, meaning that it's similar to what people call a twilight drug. So you're awake for the procedure, but you just don't really remember any of it.
Okay. And then, in terms of the fetus or the baby, do they feel pain? When they get the injection, or do you know?
Research has shown that the digoxin injection into the heart, there wouldn't be any pain. It would actually slowly stop the heartbeat. And then, of course, there's no pain after that.
Okay. And then, I don't really know much about, the development either. Is the fetus fully developed, do you know, or at that point?
What do you mean fully developed?
Do they have, you're saying that they, it stops the heartbeat.
Right.
I'm just wondering, how developed it is.
Okay. It's going to be developed, but not a viable pregnancy if it was outside of your body at that point in your pregnancy.
So it wouldn't, be able to survive outside the womb?
Not when you're 26. No.
Okay.
Technically, you'd be 24 weeks pregnant, really, from conception. So the chances of viability would be very slim. But if this is something that you're not sure about, then maybe you should be talking to your doctor. Have you been seeing a provider?
No, I was, but then I dropped off, a month or two ago. So, but you read stuff online and, you hear different things. And so I just thought you guys would know for sure. But, do you guys offer in-office consultation if I wanted to come in, or is there a fee for that to come in and actually talk to someone?
What do you want to talk to them about, like, exactly?
Well, just asking questions and making sure I'm confident in my decision. Just might be nice to have someone to talk to.
I mean, we're not going to do, like, an options counseling session. It's not necessarily something that we provide. I mean, if you want to talk about the actual procedure itself, we do that, but there's a charge.
Okay.
I mean, we can refer you out to somebody if you'd like to speak to someone about maybe not being sure about your decision.
Okay, so pretty much I would just come to you guys if I'm 100% certain to have the procedure.
Right.